The WHO warns of severe form of swine flu. Doctors are now reporting a severe form of swine flu that goes straight to the lungs, causing severe illness in otherwise healthy young people and requiring expensive hospital treatment, the World Health Organization said on Friday. Some countries are reporting that many as 15% of patients hospitalized with the new H1N1 pandemic virus need intensive care, further straining already overburdened healthcare systems, WHO said in an update on the pandemic. During the winter season in the southern hemisphere, several countries have viewed the need for intensive care as the greatest burden on health services, it has said. Preparedness measures need to anticipate this increased demand on intensive care units, which could be overwhelmed by a sudden surge in the number of severe cases. Earlier, WHO reported that H1N1 had reached epidemic levels in Japan, signaling an early start to what may be a long influenza season this year, and that it was also worsening in tropical regions. Perhaps most significantly, clinicians from around the world are reporting a very severe form of disease, also in young and otherwise healthy people, which is rarely seen during seasonal influenza infections, the WHO has said. In these patients, the virus directly infects the lung, causing severe respiratory failure. Saving these lives depends on highly specialized and demanding care in intensive care units, usually with long and very costly stays. Minority groups and indigenous populations may also have a higher risk of being severely ill with H1N1. In some studies, the risk in these groups is 4 to 5 times higher than in the general population, just like with pregnant women, the WHO has said. Although the reasons are not fully understood, possible explanations include lower standards of living and poor overall health status, including a high prevalence of conditions such as asthma, hypertension, and other immune deficiencies. The WHO says to brace for the second wave. WHO said it was advising countries in the northern hemisphere to prepare for a second wave of pandemic spread. Countries with tropical climates where the pandemic virus arrived later than elsewhere also need to prepare for an increasing number of cases, it said. Every year, seasonal flu infects between 5 and 20% of a given population and kills between 250,000 and 500,000 people globally. But because hardly anyone has immunity to the new H1N1 virus or swine flu, experts believe it will infect far more people than usual, as much as a third of the population, or maybe even up to a half. It also affects younger people more, unlike the seasonal flu, which mainly burdens the elderly, and thus may cause more severe illness and deaths among young adults and children than seasonal flu does. Information and data continue to show that certain medical conditions increase the risk of severe and fatal illness. These include respiratory disease, notably asthma, cardiovascular disease, and other immunity suppression diseases, the WHO has said. when anticipating the impact of the pandemic as more people become infected. World health officials need to be aware that many of these predisposing conditions have become much more widespread in recent decades, thus increasing the pool of vulnerable people. The WHO estimates that more than 230 million people globally have asthma, and more than 220 million people have diabetes. Obesity may also worsen the risk of severe infection, along with pregnant women, the WHO has said. So now, there's a more severe form of the swine flu. And that's not good. And once again, this could also be called pestilence. Pandemic equals pestilence. And that's what this is. It's a worldwide pandemic or event. And once again, everything that must change quickly or rapidly. Change must happen. And these are more signs of the end times transition days. Transition is ongoing. It's happening day by day in so many different ways all around the world. And there are many, many signs.